Good evening. Happy Friday. Welcome to the Connector Dots Pharmovation Friday edition. I hope you are having good weather where you are and are going to have a wonderful weekend. But Pharmovation Friday is our time to talk about pharmacy, medications, specific topics here on the Connector Dots. So I want to ask you if you believe in a statement. A personalized, patient-centered, systematic, and coordinated approach to medication use will vastly improve outcomes and reduce overall healthcare costs. What do you think about that? Well, that is the belief of the Get the Medicines Right Institute, or GTMRx. They have been formed not that long ago. It's a multidisciplinary group, and they have held several sessions where they've brought leaders together. And one of their most recent publications is their Blueprint for Change. It was published in July after work that was done back in February. So I'm looking forward to sharing with you today some of the highlights of their recommendations. We won't be able to go through it all in the post. I do have the link to their website, which has a Blueprint for Change resource center. And so I do encourage you to go there and even sign up as a founding member of the organization. Now, I did notice, I did not realize this, I don't know why I didn't keep track of this, that today is International World Pharmacist Day. So happy World Pharmacist Day. I know here in the US, we tend to celebrate the different pharmacist recognitions in October. Women in Pharmacy Day, we have Pharmacy Technician Day, Pharmacy Week, Pharmacy Month, all of that. So I'm glad, though, to celebrate World Pharmacy Day here with you. So let's jump in. Again, welcome. If this is your first time joining me, welcome. If you've been joining me and listening to this series of Connector Dots, where I provide brief, candid insights on healthcare and pharmacy and life for connectors and pharmovators. So today we're going to be exploring, as I mentioned, the report, the Blueprint for Change, the multidisciplinary work from Get the Medicines Right. I'm your host, Kimber Boothe. I'm a strategic pharmacy coach and consultant, and I've been a healthcare leader and entrepreneur. And I help pharmacists strategically advocate for roles and resources to advance pharmacy practice. So the recommendations we're going to get to, there's 4 main recommendations that came out of this report. And it's going to basically be how we practice healthcare, how we pay for healthcare services, how we use diagnostics, and how we integrate technology. Now, what you'll find is throughout this report, it is definitely a multidisciplinary report and definitely came together in a multidisciplinary way. Pharmacy leadership was involved, and most notably, inside of health system pharmacists, executives, and leadership did participate. I often am speaking to you about pharmacy leadership and how pharmacists can advocate, but of course, it's really critical that we do that in a multidisciplinary way. We may be the medication experts, but we are doing that in a collaborative way, and that's what I do like about this institute. I've been a signing member of this organization and definitely like how they put together this report. There's definitely several, quotes and mentions of pharmacy throughout, but it does talk about the importance of making sure it's a team effort to improve medication use outcomes. So again, the group got together in February, brought together 50 national thought leaders, had this roundtable, and came up with these recommendations, along with a vast amount of research that they had done and compiled. All of this was to design and ensure that Americans have access to personalized, patient-centered, systematic, and a coordinated approach to medication use that will vastly improve outcomes and reduce costs, which is really their belief, right? So they summarized here that they know that the appropriate use of some of the tools that they are recommending will help us improve outcomes for our patient. And they definitely note that it needs to be a team-based approach, and do mention specifically that appropriately skilled clinical pharmacists, the medication experts working in collaborative practice with physicians and other providers. Specifically, they said, there's a quote, "In providing collaborative drug therapy management, or CDTM, on interprofessional care teams, clinical pharmacists apply specific drug therapy knowledge, skills, and expertise that complement the care provided by the collaborating professionals." So definitely support of the practice of the CDTMs, or collaborative practice agreements, as it's referred to in some states, to work in this type of integrated collaborative team. So before I get into the actual recommendations, and I don't want to keep you too long, I try to keep these to about 15 minutes sessions for you all. But before we get into those, there's definitely some key insights that they summarize, kind of what they learned, that are also summarized in the report. So first, seems straightforward, but optimal patient care does require optimal medication use, right? It is critical. It is can be one of the most cost-effective ways we have to help support patients if used appropriately. Achieving medication optimization requires a more rational, patient-centered, team-based, and integrated approach called comprehensive medication management. Now, they do mention through this that there is sometimes this alphabet soup terminology that we do have to get over, and that's within the recommendations. We have to start using the same terms for this topic. So that topic of comprehensive medication management is coming to the forefront, which is one of the recommended terms from our pharmacy organizations too. There is definitely evidence that supports comprehensive medication management that improves patient outcomes as well as reducing costs. Optimal medication use does require better data, and that data must be actionable. So 2 insights there. We need to have better information to help support our patients and understand their needs with the data from our EHRs, or data that we aren't even collecting yet in our EHRs. It may require advanced diagnostics, so there's definitely a recommendation around testing and diagnostics and even pharmacogenomics. There are new models that will be necessary for broad access to the comprehensive medication management, and that health insurance plan sponsors save more money from medication optimization. So in our fee-for-service model, this does not always work well, but we need to include this as part of our management, and definitely as we transition to value-based payments, it is well worth the investment of having the necessary resources to support optimal medication management. Of course, medication optimization provides patients with more health improvement. And unfortunately, the inability to meet desired clinical outcomes is an important trigger for identifying patients who can benefit from the most comprehensive medication management. So while it's unfortunate that patients are having poor outcomes, we can definitely identify who would benefit the most by using the data in our electronic health records to identify those patients. And then finally, their key insight was medication optimization leadership requires buy-in and an organizational supporting culture. So again, that is some of their key insights, and I'm going to jump right into the recommendation. Again, there's 4 areas of recommendations with some specific recommendations under those. The first is practice and care delivery transformation. So regarding this, we definitely have that we need to have tools and engage and educate our key stakeholders. We need to identify evidence to promote the value of optimized medication use for payers, consumers, and providers. We need to develop the essential structures and the language of the value-based agreements with comprehensive med management services. We have to offer guidance and case uses to our key stakeholders on contract standards and consistent practice. And finally, identify leadership and champions to ensure rapid practice transformation nationwide. Right? We have had some of these aspects available to us and are being done, but is it truly comprehensive and integrated? And I think as we improve the access to electronic health records from a variety of our pharmacy team members, that will be very valuable. But definitely, I, of course, am a firm believer of integrating both embedded, and I use the term more these days of integrating just because of COVID, and space, right? Space and distance. We may not be able to put a pharmacist in every primary care clinic, but that clinic can be supported by an integrated pharmacist who has full access to that electronic health record and can document in the charts and truly be part of the integrated team because they have the information they need to practice under a CDTM agreement. The next area is payment and policy solutions. So definitely a need there to identify foundational elements of policy solutions necessary to overcome barriers to the adoption of CMM and optimization of medication and gene therapies. Identify successful use cases for the utilization and advocacy and coalition building, and identify payment solutions and policy and payment strategies that reward the value of CMM in terms of cost, quality, and patient outcomes. And finally, design an approach to educate and engage policymakers about CMM. The last and fourth recommendation is health IT to support optimized medication use. This is sub-recommendations here are to work with regulators, practice organizers, and industry to establish standards and best practices that drive standardization and interoperability, right? How important is that? We have electronic health records, but we still struggle with interoperability. Develop guidance for health IT requirements to support the successful integration of CMM services. Aggregate, integrate new data to help support optimized medication use through artificial intelligence. And some recommendations there are understanding social determinants of health, pharmacogenomics data, clinical analytics, genomics risk, and population health. Then promote utilization of the AI-enabled risk stratification tools to support population health management to aid health systems, payers, and prescribers to identify patients who need CMM services. And finally, further develop and share the health IT and artificial intelligence maturity matrix and leadership IT checklist. That one is newer to me, and I look forward to exploring that. In my program that I have called Pharmovation, I have a whole section on, innovation, pharmacy, innovation, and technology. And definitely artificial intelligence has been a key topic within that module as we do need to invest and understand that more and more. So not to remove people, but so that people can be practicing at the top of their license and we can achieve better health outcomes for our patients. So that's all we really have time to go over today. I think maybe I'll either do another connector dots on these or maybe a full blog post, which are definitely a little bit longer when I do my blog posts on the connector life. I just wanted to share those insights. And again, make sure you're aware of this organization. I think there's some useful tools on it, and we're definitely have pharmacists engaging in this multidisciplinary group. So I do want to invite you to join me for future live connector dots. Monday topics are, it's Monday Mindset Monday. I have actually not specifically chosen the topic for that day yet. So if there is a mindset topic that you're interested in and want me to discuss on Monday, please send me a message or drop a note in the comments section of this post. Finally, I do want to invite you to go to kimberbooth.com/connect to join my email list, because I'm providing my members in my community with these recordings in an organized online portal, because I know sometimes it's hard within your feed, whether you're on LinkedIn or Facebook, to catch these all the time. I try to do it at the time that most people have requested, kind of in the late evening, or excuse me, early evening, as some people are heading home or towards the end of their day. So thank you again for joining me. I appreciate the comments I've been getting and the support to do this, and it's my pleasure and honor to be sharing some of these insights with you as I am trying to strive towards my goal of helping to advance pharmacy practice and increase the demand for pharmacists as we ultimately improve patient outcomes and achieve the whole quadruple aim. So I leave you with be bold, be a connector, and advance pharmacy practice. Thank you so much. Have a wonderful weekend. Bye-bye.